Hey there, Nurse Cass here. Thanks for stopping by. Today I'd like to just take a few minutes of your time to discuss a topic that I find quite interesting. Throughout my studies to get my RN, while I've been working to get my RN, and now currently while I am pursuing a nurse practitioner degree, I have read countless peer-reviewed studies. And I've come to notice that there is quite a disconnect between what we regard in the medical community as a best practice and what we actually see happening in practice. While I'm working in the sub-psych specialty of drug and alcohol rehab, I have really noticed that we have this culture of pushing pills. It's a medication for every single little thing. And when you're talking with people that have multiple diagnoses, it can really add up to a lot of pills. I'm not saying that pills are bad, but in our culture, even throughout the day, you could probably count, I've seen 5 different ads for 5 different medications. So it's really heavily honed in on us that there is some sort of magic medicine out there, while evidence suggests otherwise. It is very well understood that, especially for psychiatric specialties, that a combination therapy of both psychotropic medication and psychotherapies tends to work best. So I've come up with this idea that, all right, medicine's good, therapies are good, but there's no such thing as just one thing. And we should really be looking at our clients with more of a holistic approach. Okay, stop a moment. I am well aware that there is this common misconception that when you hear the word holistic, it means some hippie home remedies. But in this particular setting, we are saying that holistic care is comprehensive health care that encompasses both physical, psychological, social, and even your spiritual needs. We're not just treating one little body part. We want to treat the person as a whole human being. And we understand throughout lots and lots of medical research that there is a connection between a person's physical health and their mental well-being, which makes sense. If you think about it, someone who's very sick, they may not feel well. When you don't feel well, you are not spiritually well, and you may suffer from depression, or vice versa. Let's say that you are conflicted with some sort of psychiatric disorder. Often that leads to the cascade of not taking care of yourself fully, and you'll see a lot of, self-neglect. Something as simple as dental pain, or letting yourself become completely unhealthy obesity-wise. These things are all connected. So if we're looking at the person and treating them as a whole human instead of just parts of a human, we would have a lot better results. So this begs the question, why? Why, if we know that combination therapy yields optimal results and medication therapy should be combined with some psychotherapy such as cognitive behavioral therapy, which kind of helps a client learn to control their thoughts, control their emotions, why are we just focusing on prescribing medications? Did some research, and it turns out there's a few reasons. Money always is a big one. It's not always just greed, it's a matter of survivability. Medical field, though we are here for helping, is still a business at the end of the day, and psychotherapies tend to have lower reimbursement rates from insurance companies if they're covered at all. You're also talking about time. When you have someone who needs an hour of talk therapy versus a quick fill out this survey, okay, here's your prescription, you can see a lot more patients in one day just writing prescriptions. So figuring out some sort of balance there could be very helpful. And then of course there's always the accessibility aspect. Providers tend to be very spread thin, and in places that are geographically rural or areas where Medicaid tends to be the primary payer, there's a larger shortage of providers to serve those communities. So it makes sense. Let's do the quick fix, see what we can do, and cross our fingers, hope for the best. However, so far, it doesn't seem like it has been the best. So how do we fix it? A magic pill? Just kidding. I say we start at our roots as nurses, go back to our fundamentals, and look at the types of assessments that we are doing, especially in a first assessment when we're meeting a client for the first time. I apply the bio-psychosocial model to every client. I want to know about your background. So tell me biologically, how's your health? Do you have a chronic disease, diabetes, anything that we should know about that could be a long-term change over time? What's your family history like? How are you sleeping? What kind of foods do you eat? What does your exercise look like every day? All of these things kind of play into how a person is going to function biologically, and that again is connected to your psychological well-being. So let's go to the psychological part. Do you already have a diagnosis? Some people do. Some people have multiple. Some people have conflicting because they've changed over time and seen different doctors. They may already be on certain medications that are or are not working. We also want to discuss, like, what are your perceived strengths and weaknesses? Kind of helps us gauge, what does this person think about themselves? And I like to ask, what are your goals? Because that helps get them involved in their own treatment plan, gives you a little bit of ownership. And then when we talk about social, what are your relationships like? Do you have a support system? For psych, that's super important. What kind of people do you have around you? Who's going to help you out if you're having a bad day? Are you employed? What kind of work do you do? What's your education status? Do you have a criminal record? All of those things could present potential hurdles to some forms of therapy that you may or may not want to provide for the person. So they're important questions to ask. Something else that I always add and kind of tack on to the model is the technological aspect. We live in this world. So much information at the tips of our fingers, and some people still don't use it. So I like to ask, do you have a computer? Do you have access to the internet? Do you have a cell phone? Because if I'm going to prescribe CBT via telehealth and you can't access it, then we are going to have to figure something else out. But some people don't speak up and let the provider know. They just say, okay, sure, walk away, see you in 6 months. What happened? So even something as simple as explaining an online portal to a patient could be helpful. Maybe they do have a computer, but they don't know how to get in. They don't know how to reset their password. They just need a little bit more guidance, where asking all these questions and looking at the person as one whole unit can help a practitioner figure out what's the best thing for you. So as we know, I am a big fan of the psychotherapies and making sure that people are able to figure out their feelings and express them and control them. But we all know that some people still do need medication. And something that I stumbled upon in my studies was the pharmacogenetic testing. Pharmacogenetic testing. Say that 3 times fast. So basically they'll do a DNA blood test to see what medications you respond or do not respond to. And in my opinion, that could be an amazing starting point for most people, because by the time I see people, they'll tell me 10 things they've tried and failed. And that just sounds like a long wait. Whereas if we start putting more effort and research and money and time into figuring out, well, what works for certain people? We are all different on the inside. We could maybe have a more clear starting point. It's kind of like, the idea to me is when you go to the doctor and you have a bacterial infection, they do a swab and they do a culture and sensitivity to see which antibiotics work best to kill that bacteria. Kind of could be like that, just an automatic, well, let's see what meds will work for you and start there. So that's a hope that I have for future research. And I also would like to see the expansion of telehealth, because so much of it can be done, at least in psych. I do want to see the person. I feel like a phone call isn't as good as seeing you, but I can kind of get an idea of what your facial expressions are doing, what your hands are doing, if you're really fidgety, by being on a live feed, seeing you and speaking to you at the same time. So especially for those areas where they just don't have enough providers, that would be a really good place to put some extra effort in to maybe get a little bit more involved and have the clients be more available to do those psychotherapies. And then of course, there's always going to be the interprofessional collaboration. If my specialty is psych, yes, I have worked in regular med-surg and do have some of that background, but I'm not treating your diabetes if I am your psych provider. But I would like to have someone to collaborate with that knows, hey, this patient's on these medications. and then we can discuss any potential overlap or interactions, and kind of everybody works together to make sure that client is getting what they need. So networks kind of need to be stronger and more connected. That's probably a technology thing, where maybe some kind of database. I know that when insurance started coming into medications and we could see like, oh, this person picked up this medication at this pharmacy and this one here and they interact, let's not let them take it together. It became like a really great way to preserve incidents from happening and stop mistakes. So I do feel like there's just so much potential between the technology that's out there and what it could be to help bring these services to the people that need them. Psychiatric disorders don't discriminate. Rich, poor, educated, uneducated, it doesn't matter. I'm sure some of you either have or know people who have ADHD or anxiety, depression, bipolar, schizophrenia. They're out there and there's nothing to be afraid of because there are many, many treatments available. You just have to figure out what's the right treatment for you or your patient. And also remember that 1 in 4 people who have a mental health disorder also suffer from substance use disorders. So again, everything's connected, and there is a big burden on society. A study in Canada found that their financial impact just in Canada per year is $50 billion related to the mental health crisis. So please, if you take nothing else away, take away the one thing I want to tell you, and that's there is no such thing as just one thing. Thank you for your time.